Hello, my name is Ellen Bass, and I am on the hospital board at RMC and also the foundation board at RMC. I wanted to go over a couple of things that were going on with both of these organizations, and one would be Heart Day screenings. The cost on this is $50. You can call the number that's on the screen now. It also includes your EKG, your lipid profile, blood pressure screening, complete metabolic profile, C protein, and a Heart Day t-shirt to take home with you. And we also have an opportunity with our foundation for a scholarship. This is called the Martha Vandervoort Scholarship. If any of you seniors out there are interested in applying, you may go on the website at RMC, and you must be a senior at a high school in Calhoun County or homeschool, either one. And you must also show leadership skills, community service skills, maintain a 3.0 GPA, and we would love to have you apply. There's also your guidance counselors at your schools have applications, and you're more than welcome to get with them and find out more about it also.
Good afternoon. My name is Dr. Raul Magadi. I'm an infectious disease specialist. I also happen to be the chief of staff. I'm one of the lead physicians at the COVID ward. It's the end of the start of the month. So just some kind of update on numbers. As of this week, more than 905,000 COVID-19 deaths have been reported in the U.S. alone. And that's the highest by far, no number in any country. There have been about 399 million cases globally and about 5.7 million deaths in the whole planet. Although the numbers are coming down, some states are plateauing, some states are seeing decrease in numbers. This thing is far from over. So let me just give you some numbers, especially vaccination numbers, and the reason why we were pushing for vaccination. Here in Calhoun County, we have about 115,000 people as a population. In early July of last year, 2021, start of Delta wave, about 40,000 Calhoun County residents, or about 35.12%, availed themselves of at least one dose of the COVID-19, either Pfizer, Moderna, or J&J. And about 33,000, or 28.98%, had 2 doses. After about 2 months, in end of September 2021, we still had that Delta wave at that time. About 55,000, or 47.98%, had at least one dose, and about 44,000, or 38.73%, had 2 doses. So from a span of 2 months, our numbers as far as vaccination is concerned, jumped 10 points. So we were happy. I said, we were saying, yeah, maybe this is going to go up. But the numbers kind of stalled. As of yesterday, which is about 5 months after September, it's about 63,955 Calhoun County residents availed themselves of at least one dose. So that's about 55.7%. of one dose of the COVID vaccine, and about 52,084 had 2 doses, so about 45.25. From September of last year, wherein we had 38.73% who had 2 doses of vaccine, to yesterday, so that's about 5 months, we went up from 38.73% to 45.25%. So we only jumped 7 points. Remember, during the Delta wave, from July to September, we went up 10 points during that time, 2 months. But in a span of 4 or 5 months, we kind of stalled. It still increased, but it only increased 7 points. So it slowed down, and the reason why we're pushing for this is we're personally seeing cases in the hospital. Majority of them, especially those who are not doing well or did not make it, are mostly not vaccinated. If they were vaccinated, they did not have booster. And a lot of people are saying, yeah, a lot of people are getting sick in spite of vaccination. There's some partial truth to that, but I'm going to give you a real world Omicron specific numbers about vaccine efficacy. And after this, these numbers, after I give you these numbers, you will say, yeah, this is really a function of immune system. But for the most part, it's a function of age. So let me give you a number that I got about a week ago from Israel Mayo Clinic. So for 50 to 64 age group, if you're unvaccinated, you have a rate of severe illness to hospitalization of 78 per 100,000. So for 100,000 people not vaccinated, about 78 of them will be hospitalized because of severe illness. For the vaccinated, meaning they have had at least 2 doses of mRNA vaccine, Pfizer or Moderna, or 1 dose of J&J vaccine, the rate of severe illness or hospitalization is about 4 per 100,000. So it went down from 78 for unvaccinated to 4 if you have some vaccination. But if you are vaccinated and boosted, that rate further goes down to 2 per 100,000. So from 78 unvaccinated to 4 vaccinated without booster to 2 vaccinated and boosted. So there's a big difference there as far as rate of hospitalization and severe illness is concerned. So that's for 50 to 64. But if you are in the 65 and over age group, totally different. So if you are 65 and above, for unvaccinated, they have a rate of severe illness / hospitalization of about 239 per 100,000. Vaccinated, meaning at least 2 doses of mRNA, Pfizer, Moderna, or J&J, the rate goes down to 27. And for vaccinated and boosted, the rate goes down to 5 per 100,000. So if you're 65 and above, you're not vaccinated, the rate is 239 per 100,000. If you're 65 and above, you have some vaccination but not boosted, your rate is 27 per 100,000. But if you're vaccinated and boosted, the rate goes down further to 5 per 100,000. These are real world numbers. This is not something that we're coming up with. These are readily available numbers from the internet, some website in Mayo Clinic. So this really goes to show that nobody has said that the vaccines are 100% effective. There's some breakthrough infections, but if you have infection, your chances of getting severe illness to the point that you might be hospitalized or end up in the emergency room will be much, much lower compared to somebody who have not been vaccinated or just partially vaccinated or not boosted even. The same analogy that we use, if you wear a bulletproof vest, the bullet's still gonna hit you. It's still gonna sting, but at least you're not dead. It's not gonna cause some fatal injury because somehow the bulletproof vest offers some protection. That being said, every time that we close this talk about COVID, we always mention the 4 letters that we have been telling you since the start of pandemic: WWWV, WWW. Wash your hands, watch your distance, wear your mask, vaccinate, and if eligible, please get your booster. Again, before I go, a little bit of a PSA. I would like to repeat that we have a sick clinic at Jacksonville Family Clinic. That's Wednesdays from 8 to 4 p. Again, this is a sick clinic, meaning if you're symptomatic, you think that you might have COVID, this is a place that you could go because the local urgent cares or even the ER might be inundated with patients. If you're not really sick enough to warrant to go to the emergency room, you could avail of their services. This is not the clinic to go to if you just want to be tested because you're traveling somewhere. It's a requirement for travel. You don't have any symptoms. This is not the clinic for you. This is specifically a sick clinic. And last PSA is next town hall meeting. We have an interesting topic, and specifically we're going to be talking about long haul COVID. These are symptoms people manifesting after they have had the acute phase of illness. So they don't have any, they don't have infection anymore. They're not contagious anymore, but somehow they have all those manifestations that people talk about: brain fog, easy fatigability, less exercise tolerance, and things like that. So we have two panel physicians that we invited. One is a pulmonologist and one is a neurologist. Please stay tuned. It would be an interesting topic. Again, good afternoon and thank you for listening.